move on to the next presenter, yeah. So our next presenter is Dr. Nof El-Masoud, and she's an artery resident from the Family Medicine at King Faisal Specialist Hospital and Research Center. And she's going to be discussing the prevalence of osteoporosis and osteopenia among older adults in a community-based setting in Riyadh, Saudi Arabia.
Okay, good afternoon, everyone. It is my great pleasure and honor to be presenting here on behalf of my research team. And we're presenting our research titled The Prevalence of Osteoporosis and Osteopenia Among the Older Adult in a Community-Based Setting. So I would like to, first of all, to thank the co-authors who are participated in this project, and special thanks to Dr. Muad Al-Khnezan, who is my mentor and the mastermind behind this project. So the authors have nothing to disclose. So here are the outlines of my talk today. So of course, as you all know, that osteopenia and osteoporosis are conditions of loss and decrease in bone density and mass, which can ultimately lead to fracture, that can lead to major disabilities and poor quality of life. In a recent meta-analysis, the prevalence of osteoporosis was found to be 18.3%, with the highest prevalence reported in Africa. And in a most recent estimate of osteoporosis in Saudi Arabia, it showed that osteoporosis is 52.8% in men and 63% in men. So the objective of our study is to measure the prevalence of osteoporosis and osteopenia among the older adult attending family medicine clinic at King Faisal Specialist Hospital and Research Center. So we did a retrospective cross-sectional study, took place in the Family Medicine and Polyclinic at King Faisal Specialist Hospital and Research Center between the 1st of January 2016 until the 31st of December 2021. And our study was approved by the Office of Research Affairs in our hospital. So for the inclusion and the selection of our study subjects, we included all adults who are aged 60 years and above, who were screened for osteoporosis using a DEXA scan. Patients who had secondary causes of osteoporosis were excluded. So as for the data collection, we collected the social demographics, including age, gender, educational level, marital status, BMI, and the current smoking status. We gathered also medical history, including past medical history of rheumatoid arthritis, diabetes, hypertension, hypothyroidism, neoplasm, vitamin D deficiency, steroid use, and previous history of fracture. And for the BMD measurement, we gathered the information of DEXA that was done at the lumbar spine and the femoral neck, and we used the WHO criteria for diagnosing osteoporosis. So we studied the data of 1,302 subjects. Their mean age was 68 years with a standard deviation of 6.9 years. So the majority of our population were females with a percentage of 75% and 25% were males. BMI, majority of our subjects were obese with a percentage of 55%, followed by overweight, normal weight, and underweight. And most of our subjects were married. So for the other comorbidities and for the smoking, 12% were smokers, around 51% were diabetic, only 0.8% had rheumatoid arthritis, around 56% had hypertension. For vitamin D deficiency, around 5.1 showed vitamin D deficiency, neoplasm 2.7%, previous fracture were recorded to be 4.1%, hypothyroidism 20%, almost 20% had hypothyroidism. So for the osteoporosis and osteopenia prevalence, when taking into consideration the lumbar BMD, around 41% showed, 11.8% showed osteoporosis, 41 showed osteopenia, where when we take a look at the femoral BMD, around 8.2% showed osteoporosis, 50.2% showed osteopenia. So if we do the age-specific prevalence, the yellow represent the osteoporosis, green represent the osteopenia, and the blue represent the normal. So of course, as you can see in both lumbar and femoral BMD, as a person ages, the osteoporosis prevalence increases. If we take a look at the gender-specific prevalence, in females, around 13% showed osteoporosis, 45% showed osteopenia for the lumbar BMD. When taking into consideration the femoral BMD, only 7% showed osteoporosis, 50% showed osteopenia, and the rest were normal. As for males, the lumbar BMD showed 8% of osteoporosis, 31% of osteopenia. In the femoral BMD, 12% showed osteoporosis and 52% showed osteopenia. So this table summarizes the distribution of the patient when you take in and when we do the association between osteoporosis and the other study variables. Age, BMI, gender, hypertension, and steroids show the strong association with osteoporosis with a p-value less than 0.05. So in summary, the prevalence of osteoporosis were found to be 8.2% and 11.8% based on the femoral and lumbar BMD respectively, while osteopenia was 50.2% and 41.2% based on femoral and lumbar BMD respectively. There are several studies in the literature measuring the prevalence of osteoporosis. For example, one of the studies measured the prevalence to be 52.8 in women and 63.6 in men. Okay. While the other studies showed the screening of DICSA to be 58.6% showed low BMD. Other studies showed the osteoporosis prevalence to be 29.7% and 22% in people aged 60 years and above. Another last study showed the osteoporosis prevalence to be between around 38 to 47% in people who are aged 50 to 78 years who are living in the Western Coast. So for osteopenia, also several studies measured the osteopenia prevalence to be 30.6%. This study was studied in only females. Others studied in males above the age of 50 showed osteopenia to be 40.7%. And so such discrepancies or this discrepancy between the prevalences in our study and the previous studies could be explained by the differences between our study subjects, their sample size to ours, the subject characteristics, the study settings, if it was a hospital-based setting, an outpatient setting, or and the BMD purpose and the indication where it was first ordered to the patient. So one of the study limitation that our study is a retrospective study. Of course, it carries the risk of recall bias. So we could have missing information while gathering it from the electronic record. Also, we did not get all confounders. We did not account it in our study. For the study strengths, we had a very large number of subjects, which around more than 1,300 patients, and it is also in a community-based setting. So in conclusion, osteoporosis and osteopenia are prevalent in the geriatric population in Saudi Arabia. Our study is one of the first community-based studies in Saudi Arabia that shed a light on the prevalence of osteoporosis and osteopenia in the geriatric population. Of course, further study will facilitate the policymaker and the healthcare manager to make decision, and also emphasis on primary care physician to follow the local and international guideline for screening, diagnosis, and eventually treating osteoporosis. And furthermore, we call for local campaign for knowledge dissemination and awareness in our country. So thank you all for your kind attention. If you have any questions.